Yes, can I audible? Can I audible? Okay. So starting with today's lecture, we started with the lecture number 34 from H.A. Roberts' philosophy. So in this lecture number 34 is deflected current by H.A. Robert. So in this we completed near about half topic. So in this, yes, yes, हाँ बोल ना. हो करा ना. चल. So we started with topic that is deflected current. So in this, Dr. H. Robert explained about that is some common obstacles that interfere with the smooth curative pathway or the process of homeopathic indicated remedies. So in this, there are he explained about two types of errors. First error is error from part of patient and second error from part of physician. So in this error from part of patient we started. So in this there are near about 9 errors that are from the part of patient, and secondly that is the errors from the part of physician. So it is again divided into errors of prescription and the errors of pharmacy. So errors of prescription means when doctor makes some mistakes while prescribing the medicine due to different reasons, that is due to the favorite symptoms he observed, or the only prescription that is the keynote prescription that may get wrong sometimes. So in this is the errors from prescription side, and secondly the errors from pharmacy, that is when we give the medicine to the patient, what is the actual quality of that medicine, it also acts as a obstacles in the pathway of cure. So in this it is regarding the source of pharmacy or the drugs, or it is regarding the potency of that medicine. So in this way there are two types of errors, errors from the part of patient and secondly errors from the part of physician. So in this we started with the errors from the part of patient. So in this the first error was that is the advanced pathological condition. What is the first error? Advanced pathological condition, when there is a advanced pathological condition occurred in a patient that acts as a obstacles in the pathway of cure, that cannot be cured completely if there are the advanced pathological conditions. Then secondly the treatment by X-ray and radium. This treatment causes the, along with the disease cells, it also damages the healthy cells, and it is the one of the most important obstacles that may come when we treat that patient or that particular tissue with a homeopathic medicines. Then thirdly they explain about the psychic trauma, sorry, thirdly that is non-pathological mechanical obstruction by foreign body, and in this they explain about there are different non-pathological mechanical obstructions by foreign body. In this they explain two examples, that is regarding the ear and nose. When children take some foreign body in his or her nose or ear, that may cause damage to that particular tissue, and when we remove that foreign body, then and then only that patient get cured. So that foreign body acts as a obstacles in a pathway of cure. So this is the third obstacles in the pathway of cure. Then next is a psychic trauma, emotional stresses and unhappy domestic condition. So in this, when There is a psychic trauma occurs in a patient or emotional stresses that can be communicated with a physician, but the unhappy domestic condition, most of the time patient cannot share that things with a physician, and when that things are not shared with a physician, that may act as obstacles in the pathway of cure. That is, we cannot get the proper picture of that patient, and we can prescribe the proper medicine to that patient, so it may act as obstacles in the pathway of cure. Then next is a over anxiety, worry, industrial demand. These are the different things. That is, if patient having that psychological condition related to over anxiety, worry, industrial demand, that may act as obstacles when we give the medicine without considering these things, that may act as obstacles, and cure may be hampered. So, and the next is the increasing use of sedatives, bromides, narcotics, and analgesics. That is, these are the different drugs that are used by many of the patients before taking the medicine, homeopathic medicine, and that may act as obstacles. That is, most of the time it is used for the removal of a pain or to activate the body conditions. So in this, that is increasing use of sedatives, bromides, narcotics, and analgesic. All these things are the most important obstacles in the pathway of cure. So up till now we finished the six obstacles that come in the pathway of cure while giving the homeopathic medicine. Now the next obstacle is a use of cosmetics. So three errors remaining from the patient part, that is use of cosmetic, then nextly the problems of diet, and nextly the lack of exercise. So these six obstacles we covers, or we called it as errors from the part of physician. All of you understand about these six errors, or anyone having any difficulty regarding it? Yes. Can we start the next error, that is use of cosmetics? Okay, so uh, next seventh error is use of cosmetics. So in this, cosmetics may prove the obstacles to cure just as surely as narcotics and coal tar derivatives. Many cosmetics preparations contain substances advertised to suppress perspiration, eruption, or to remove hair growth. Most physicians see cases definitely traceable to such measures. The suppressed eruptions and their sequelae are endless. We have seen a case of a progressive paralysis in a young woman, which she herself traced to the use of a depilatory preparation. That is, in this, the use of cosmetics means when we use the cosmetics, mainly the cosmetics are prepared from the narcotics and having the coal tar derivatives in it. And these cosmetics preparations substances are mainly advertised for the suppression of perspiration, eruption, and the remove hair growth. What is the hair growth on the body that can be removed with this cosmetics? Then there is a suppression of perspiration, and what are the different eruptions that come on the body that also get suppressed by these cosmetics. And we know that when we suppress anything by these external uses, the body get hampered, and the it may act as obstacles in the pathway of cure. So in this, he also explained one lady having a progressive paralysis after using of lot of cosmetics. Then nextly, Dr. H. Robert explained as an eminent prescriber reported a case of a persistent coccus cacti cough which refused to yield until he overhauled the young woman to stop the use of her lipsticks when the cough ceased. That is, second example he explained as a young woman using a lipstick, and that using of lipstick make in her, that is the cough, and when he stopped the use of that lipstick, then his then her cough is ceased, that is disappeared. So this is one of the example regarding the use of cosmetics. Then nextly he explained as even the old school pharmaceutical journals are beginning to report a great variety of cases which have been traced to perfumes and perfumed cosmetics, and even to cite a physiological action of their ingredients. It is notable that some of these cases occurred not in uses of cosmetic products but in those associated with them. The homeopathic physician understands the power of ambergris, musk, etc. to produce symptom in the potency. Hahnemann taught the power of olfaction on sensitive patients. Modern medical lore is full of the allergic reactions of sensitive patients to a variety of substances in the most minute form. When even the dominant school of medicine recognizes these hazards, the homeopathic physician must never neglect consideration of such a deflection of the current. So, in this para, Dr. H. Robert want to explain that what are the cosmetics? That cosmetics are mainly used for to suppress the many things that are come on the body externally. That is suppression of perspiration, there is the suppression of eruption, and that is the removal of hair growth. And when we use that things may hamper the body and that may act as obstacles in the pathway of cure. So to explain that, Dr. H. Robert give two examples. That is the young lady having a paralysis who is using most of the cosmetics, and the secondly the young lady having a cough, that cough not seized by anything, but when she stop her lipstick using, then his cough is disappeared. And along with this he want to explain that is Dr. Hahnemann explain about the patient, that is the patients are most of the patient are sensitive, that may be sensitive to olfactions by the olfaction way in a sensitive patient, and that sensitive patient may get hampered with these cosmetics use, that is even small use of cosmetics that may hamper the pathway of cure in a patient when he is taking the homeopathic treatment. So it is dangerous to use the lot of cosmetics as they having a lot of side effects in a patient. And when patient is taking a homeopathic treatment and he is using a lot of cosmetics, that cosmetics may act as a obstacles in the pathway of cure. So this is the seventh error in the pathway of cure, that is the use of cosmetics from the patient side. Then the next error is a problem of diets. So what Dr. H. Robert explained about this, we will see. Then there is a problem of diet. The so-called soft drinks follow closely the record of the home drugging in distorting the case. The modern craze for slender figures with the unbalanced diets prescribed by the laity may be an obstacle to cure. That is, the next problem is the problem with a diet. The diet, when we take diet in large amount, it is also a problem. When we take the diet in a less amount, it may be a problem. So diet may be in a balanced state, and when it is not in a balanced state, it may act as a obstacles in the pathway of cure. That is, to maintain the figure, most of the ladies do not take the proper diet, and that may act as obstacles in the pathway of cure. That is explained by H. Robert. That is not because the physician cannot correct the condition with a proper balanced diet plus an indicated remedy, but because of a psychological barrier, the unwillingness to accept a suitable diet with a corresponding normal weight. That is, uh, in the other words, the patient who suffers willingly from malnutrition can be brought back to normal only if his cooperation is gained, and if the case comes to the physician before dangerous physiological changes set in. On the other hand, There is the malnutrition resulting from an unbalanced diet, correctly traceable to depressed budget. This condition has grown rapidly during the depression years and the effects are still shown in many cases. This has to be met not only with the homeopathic remedy but with economic equilibrium and well thought out the diet if the patient is to be cured. Here we meet an economic obstacle that is often beyond the help of the physician. So this is the eighth error, that is the problem with the diet. So when Dr. H. A. Robert explained about the problem with diet, it is the diet when we take in a large amount also, when we take it in a less amount also, and mostly it is related to the mentality, that is if the patient having a proper mentality to maintain the balanced diet, then and then it cannot act as obstacles. But when we prescribe the proper balanced diet but patient don't having the mentality to maintain it, that is it may be a over diet or it may be a less diet, and when there is a less diet there is a malnutrition that may act in a patient as a most important obstacles. And when it is a over diet, that is if a patient do not follow the balanced diet, that overweight also act as a obstacles in the pathway of cure. So both these things, that is overweight also or underweight also, this act as a obstacles in the pathway of cure, and it is very important to maintain the equilibrium in a patient, that is the regarding the balanced diet, and when he maintains that balanced diet, then and then only it cannot act as a obstacles in the pathway of cure. Otherwise over diet or under diet both act as a obstacles in a pathway of cure when we are prescribing the medicine in that particular patient. So this is the one of the error that may come in the process of cure, that come in the process of cure. Then next or the last error from the part of physician is the lack of exercise. So up till now all of you understand this eight error from the part of physician, sorry, from the part of patient. Are you listening? Now the next error is lack of exercise. So we will see first what Dr. A.J. Robert explained about it. The question of proper exercise would seem to lie within the province of the physician. We recall one case, however, where the patient, a woman past middle life, was instructed to get out of the house into the open and cultivate her interest in wild flowers, thus getting her interest outside herself along with the fresh air and sunshine. We supposed the prescription was being filled as we were greeted with a fresh wild flowers every call we made, but she did not seem to gain in strength, nor did her color improve. Some time later, after she left us for a more symptomatic physician, we found that her husband faithfully went to the fields and gathered fresh flowers for the vases while she rested from the prospect of his endeavors in her behalf. There are the patient who cannot take a strenuous exercise because of pathological obstacles. There are patients who are so restricted by circumstances that they get little opportunity for exercise in the open air. But such patients are usually chronic with a long history and a poor prognosis. We usually accept the situation and do the best we can toward homeopathic palliation, and surprising as it may be to us, we sometimes approach cure in spite of the difficulties. But the patient who cannot cooperate but will not and perhaps even leads to believe she has made the attempt herself deflects the current of cure at its very source, then we the question the value of our prescription and the wonder why the indicated remedy failed to work. One of our hardest problem is the patient who cannot seem to rely the old chronic and the long out seemingly not overwhelming history and the with a clear picture of the remedy. So in this uh, para, Dr. H. Robert want to explain that is the patient who are not willing to exercise or who are not able to exercise. Willing is different and ability is different. There are so many patients who cannot exercise even with the willingness. That is, they having some problem in their extremities, in their pathological condition that they cannot exercise. So in this patient, this lack of exercise act as obstacles in the pathway of cure. That is, the patient want to exercise, the physician can advise exercise, but due to the pathological condition, that is due to some difficulties in her extremities, due to some difficulties in her vital organs, that may act as a lacking of exercise in these patients, and due to the lack of exercise, due to lack of movement, these things act as obstacles in the pathway of cure. And this is the most important thing, that is the patient don't having the ability to exercise, the patient having don't having the willingness, it is different thing, but the patient don't having the ability to exercise, it is the different thing. And when a patient is not able to exercise, it is most important obstacles in the pathway of cure when we prescribe the medicine to that patient, as there is no any way to make them exercise. So this is one of the obstacles in the pathway of cure, or it is one of the error from the part of a patient, that is the lack of exercise. So in this way there are near about 9 errors from the part of patient. First one, that is advanced pathological condition. Secondly, treatment by X-ray and radiation. Then next is non-pathological, mechanical obstruction by foreign body. Then psychic trauma and emotional stresses. Then next, over anxiety, worry, industrial demand. Then increasing use of sedatives, bromides, narcotics and analgesic. Then use of cosmetics, problem of diet and the lack of exercise. So these are the errors that comes from the part of patient, and it may act as obstacles in the process of cure. Now the second part of chapter start, that is the errors from the part of physician. So what are the different errors that comes from the part of physician? It is divided into two parts, that is errors in physician and errors in a pharmacy. So first we will see what are the different errors that comes from the part of a prescription. So in this, when physician makes some mistakes in prescribing the medicine, that we call it as an error of prescription. So in this, the error from prescription, they explain about the two errors, that is the favorite symptom and the keynote prescription. So what Dr. H. Robert explained about it, we will see in this next para, that is one of one of our hardest problem is the patient who cannot seem to rally the old chronic with a long but seemingly not whelming history and with a clear picture of a remedy. Somewhere here there is an obstacle to cure, and we must plumb to the history, physical, mental, emotional, to remove the obstacles or measure it, and to measure as well our remedy or its potency, to determine whether it is the simillimum in likeness of symptomatology and the energy. Another obstacle to cure is the ease with which the physician judgments may be overbalanced in favor of the patient's favorite symptom. This may seem a trifling matter, but the frequent repetition of troublesome symptoms may so wrap the true picture of the case that the symptomatology seem to reflect an entirely different remedy than those true but less conspicuous indications that are actually present. The patient does this unconsciously by remembering the most troublesome factors and forgetting the seemingly minor atoms that should furnish the clue to the remedy. We have discussed some of the obstacles to cure as they affect the patient or the physician. So, in this para, they explain about the two errors from the prescription side, that is regarding the keynote prescription and regarding the favorite symptom. So in this, when the physician cannot take the all the case, that is regarding his physical condition, mental condition or the emotional condition, then it may get wrong, that is the physician cannot consider the totality of symptoms, and when totality of symptom is not covered, then many of the times the what is the prescription it may get wrong, and that wrong prescription may act as a obstacles or it is the mistake of a physician while prescribing the medicine. This is the keynote prescription, regarding the keynote prescription. And secondly, they explain about the favorite symptom. So what is the favorite symptom? That is the symptoms that are explained by the patient number of times, or the patient who focuses on that favorite symptoms, but along with this favorite symptom the actual true picture of the disease get seized or cannot open to the physician. So in this way the physician may prescribe on this on these favorite symptoms that are told by the physician patient. So in this way it may get the wrong picture to the physician and may select the wrong medicine. एरर फ्रॉम द पार्ट ऑफ प्रिस्क्रिप्शन याच्यामध्ये त्यांनी दोन एक्सप्लेन केलेत, एक तर कीनोट प्रिस्क्रिप्शन आणि सेकंडली फेवरेट सिम्पटम्स. तर कीनोट प्रिस्क्रिप्शन मध्ये काय एक्सप्लेन केले त्यांनी की जेव्हा कीनोट प्रिस्क्रिप्शन म्हणजे एक दोन सिम्पटम बघितले आणि पेशंटला रेमेडी प्रिस्क्राईब केली तर नंबर ऑफ टाइम काय होऊ शकतं, हे रॉंग पण होऊ शकतं, कारण की या कंडिशनमध्ये फिजिशियननी त्याची टोटॅलिटी कन्सिडर केलेली नाहीये. आणि सेकंडली फेवरेट सिम्पटम की पेशंट काय करतोय, एक दोन जे सिम्पटम आहेत ते वारंवार तेच सांगतोय, म्हणजे काही त्याचे फेवरेट सिम्पटम्स आहेत, आपण जर ते फेवरेट सिम्पटम्सच बघत बसलो आणि त्याचा ट्रू पिक्चर ऑफ डिसीज वेगळाच आहे, पण तो काय करतोय की नंबर ऑफ टाइम्स ते फेवरेट सिम्पटम्सच सांगतोय. मग आपण जर त्या फेवरेट सिम्पटम वरती जर प्रिस्क्राईब केलं तर आपलं पूर्ण रेमेडी काय होईल, रॉंग होईल. तर हे काय दोन एरर्स दॅट आर फ्रॉम द पार्ट ऑफ प्रिस्क्रिप्शन. So all of you understand up till now? Errors from the part of physician मध्ये first that is errors of prescription. मग नेक्स्ट पार्ट मध्ये त्यांनी एरर्स फ्रॉम फार्मसी एक्सप्लेन केलेत. हे इथपर्यंत कळालंय का? Yes. Okay, now the next part is the errors in the pharmacy. Let us discuss the other side of the problem, that is regarding the remedy. So in this errors in a pharmacy, first we will see what Dr. H. Robert explained, then I will explain you. Here our first problem is the source of the remedy itself. That is, what is the source of remedy? It is the first problem regarding the errors in the pharmacy. So here our first problem is the source of the remedy itself. How close to Hahnemann standard did the source of our remedy approach? In other words, how carefully did the homeopathic pharmacist identify the source of his supply? There are the different questions regarding the source of the remedy. So in this, how close to the Hahnemann standard did the source of our remedy approach? Means how we come to the source of remedy when uh, we select some remedy. Then, in other words, how carefully did the homeopathic pharmacist identify the source of his supply? Can pharmacist identify the source of his supply? Then, is the plant identical with the botanical source of our proving? That is, what is the plant identical with the botanical source of our proving? We cannot expect the Rustock's case, for instance, to be cured with some other number of member of the family if we have depended upon the proving of Rustock's as our guide. Here we enter the field of similars instead of the similimum. Was the original supply fresh and is in good condition? Substances of inferior quality cannot provide a good potency. With what degree of thoroughness did the pharmacist follow Hahnemann's instructions for potentization? With what degree of thoroughness did the provers follow instructions? So these are the different questions that H. Robert asked to the pharmacist or regarding the errors of the pharmacy. That is, what is the source? Is the source is the correct? Is the identification of plant is correct? Is the preparation of potency is correct? Is the quality of that plant is maintained? Then what are the instructions given by Hahnemann that are followed during the preparation of medicine? These are the different questions that may arise when we think about the errors from the side of a pharmacy. So in this we must able to depend absolutely upon the source of our remedies, and if there has been a carelessness in gathering the original substance in any part of the process of making the potency, in contamination in handling the potency, or in discrepancy in the in recording the provings, then we cannot but expect that the current cure will be deflected. All these details are known to the homeopathic prescriber, but we cannot refrain from pointing the out these details may spell the difference between life and death, certainly between cure and failure in many of our cases where there seem to be no reason to expect a deflection of the current of cure. The question, that is, we question whether the proving were made under proper control, how many entered into the proving, how accurately was the substance, the origin of the potency labeled. Inaccurate labeling might be the difference in possible cure of deflection by the obstacles. So, in this way, Dr. H. Robert explained the different things that may act as obstacles in the pathway of cure regarding the pharmacy, that is regarding the source, that is the source is correct, is the identification of plant is correct, is the proper quality of medicine plant is used, then while preparation of medicine, how the medicine is prepared, it is handled with a proper care, the proper instructions are followed, that is given by Dr. Hahnemann. Then how it is stored, how it is dispensed, all these things may act as obstacles in the pathway of cure. So in this, the next para he explained about, that is weighing the symptoms of the patient against those of the remedy is one of our major problem, but an even more important problem is the weighing of symptoms of the proving itself. So in next para he explain about, that is the proving. What we do, we make the medicine, and after this we do the proving of that medicine. So is the proving is doing in the correct way, or what are the result of that proving, that may also act as an error in the obstacles in the pathway of cure. So in this regarding, how great a value, we ask ourselves, shall we place upon those symptoms occasionally or rarely produced? In the proving, we are told, for instance, that the time aggravation, which is almost a keynote of Kalikarp, appeared in only one prover, yet it has been clinically confirmed so frequently that we often think of it as one of the leading symptoms of Kalikar. Or when we think of the 3am aggravation, we immediately think of Kalikarp, in spite of the fact that Kent repertory lists a number of remedies with this modality. So, he give one example regarding the Kalikar. That is, we know the symptom of Kalikar, that is the aggravation at midnight. So, aggravation at midnight, we come to the remedy, that is the Kalikar. But while proving of that Kalikar, only one prover having that symptom, that is aggravation at midnight. And when we take the repertory, in Kent's repertory there are number of remedies that having the aggravation at midnight, that is the 3 am. But we cannot think that other remedies, only we popularly known that is the Kalikarp having the aggravation, but that is the proving mistake, that is only one prover having that.
हॅलो मॅम,
हा बोल.
जॉईन होतो लेक्चर मध्ये. मी बालबाई सोबत लेक्चर करत होता तुमचा आता.
अभिषेक म्हटला तो का कृष्णा म्हटला?
नाही नाही, मी कृष्णा. अभिषेक
काय
बाई
मॅम?
नाही, मी आहे.
विजय सोबत अभिषेक करणार होता का
जॉईन
कृष्णा?
झाला मॅम मी
कॉलेजला
कृष्णा
आले का तुम्ही
कृष्णा
सगळे?
ते करत होते.
कॉलेजला
हो
आलात
मॅम,
का
कॉलेज मध्ये आहे.
सगळे?
हा,
नाही मॅम,
सगळ्यांचं
मी
नाही
घरीच
माहित.
आहे.
बर
मी जुन्नरला आहे मॅम.
बर. चालेल, अटेंडन्स पाठवताना व्यवस्थित पाठवा.
मॅम काहीतरी सांगा ऑर्गनॉनचा.
ऑर्गनॉनच शिकवते मी, तू काय ऐकलं?
मॅम खूप ऐकलं, पण तरी पण
काय तरी पण?
काय ट्रिक सांगा ना मॅम.
कधी एक्झाम तुझी?
मॅम आहे एक्झाम पुढच्या महिन्यामध्ये
मॅम,
आहे.
अजून टाइम टेबल नाही आला.
काय
टाइम टेबल नाही आला अजून.
बर बर, चालेल. अभ्यास करत राहा,
मॅम
सांगते मी.
खूप अभ्यास करायचा आहे.
ओके, आता म्यूट कर तुला.
कोणाला मॅम?
तूच म्यूट कर स्वतःला.
मॅम कसं करायचं मॅम?
ऑनलाईन पण बोर नको करू, आता शांत बस. एक तर इतक्या दिवसांनी जॉईन झालाय. थोडा पार्ट राहिला त्याच्यामुळे परत रिजॉईन केलं आपण. So they H. Robert explain one example regarding the Kali carp. All of you understand what he explained regarding the Kali carp? कळाले का हे? काली कार्पचे एक्झाम्पल काय एक्सप्लेन केलं त्यांनी? कळालं का एक्झाम्पल? हो नाही काहीतरी म्हणा.
परत सांगा मॅम.
ओके. H. रॉबर्टने काय केलं, एक एक्झाम्पल एक्सप्लेन केले. ते काय सांगतात आपल्याला, एरर्स इन फार्मसी. आतापर्यंत ते सोर्सबद्दल सांगत होते. मग सोर्स झाल्यानंतर त्यांनी नेक्स्ट पॅरामध्ये एक्सप्लेन केलं की ड्रग प्रूव्हिंग. की ड्रग प्रूव्हिंगमध्ये जर एरर असतील तर इट मे ॲक्ट ॲज अ ऑब्स्टॅकल. तर याच्यामध्ये त्यांनी एक्झाम्पल दिलं काली कार्पचं. काली कार्पमध्ये एक सिम्पटम आहे, दॅट इज ॲग्रिवेशन ॲट मिड नाईट. ॲग्रिवेशन ॲट मिड नाईट नियर अबाउट 3 AM. तर मिड नाईटमध्ये जे काही ॲग्रिवेशन आहे तर हा सिम्पटम कालिकारचा आहे. हे काय झालं, पॉप्युलर सिम्पटम झालं. आणि पण जेव्हा प्रूव्हिंग झाली होती कालिकारची, त्या प्रूव्हिंगमध्ये फक्त एका प्रूव्हरमध्येच हा सिम्पटम दिसला होता. मग हे काय झालं, त्यांचं ड्रग प्रूव्हिंगमध्ये मिस्टेक झाली की एकच पेशंटमध्ये एकच प्रूव्हरमध्ये सिम्पटम दिसला आणि तो सिम्पटम वारंवार घेण्यात येऊन तो काय झाला, पॉप्युलर झाला. आणि त्याचं काय झालं की पॉप्युलर झाल्यामुळं की आपण काय करतो की आपल्याला सिम्पटम समोर आला ॲग्रिवेशन ॲट मिड नाईट, की आपल्यासमोर कुठली रेमेडी येते, काली कार्प. पण ती फक्त एका प्रूव्हरमध्येच दिसली होती. पण त्याच्यासोबतच जेव्हा आपण केंट रेपर्टरी बघतो तर त्याच्यामध्ये ॲग्रिवेशन ॲट मिड नाईटमध्ये नंबर ऑफ रेमेडीज डॉक्टर केंटने एक्सप्लेन केल्यात. मग आपण काय करतो की त्या रेमेडीज बघत नाहीत आणि ॲग्रिवेशन ॲट मिड नाईट असेल की काली कार्प आपल्या डोक्यामध्ये येऊन जाते. कशामुळे, कारण ते पॉप्युलर सिम्पटम झालं, पण ते सिम्पटम फक्त एका प्रूव्हरमध्येच दिसलं होतं. आणि फक्त एकामध्ये दिसणं हे काय प्रत्येक ह्याच्यामध्ये येईलच असं नाही. आणि एकामध्ये प्रूव्हिंगच्या वेळी दिसलं, पण क्लिनिकली काय होतं की सिम्पटम पॉप्युलर झाल्यामुळे नंबर ऑफ पेशंटमध्ये काय होतं की जेव्हा आपण क्लिनिकली बघतो की काली कार्प दिल्याच्या नंतर काही जणांमध्ये की माहीत आहे मला की ॲग्रिवेशन ॲट मिड नाईट आहे, तर त्या कंडिशनमध्ये परत मला काय दिसतं, ॲग्रिवेशन ॲट मिड नाईट दिसतं. पण त्याच्यासाठी आपल्याला काय करायचं आहे की जे काही प्रूव्हिंगमधले एरर्स आहेत ते पण लक्षात आले पाहिजेत, की जेणेकरून आपण प्रिस्क्रिप्शन जेव्हा करतो मेडिसिनचं तेव्हा हे काय जे काही मिस्टेक्स झालेले आहेत ते काय करतात, ऑब्स्टॅकल म्हणून ॲक्ट करतात जेव्हा आपण मेडिसिन प्रिस्क्राईब करतो तेव्हा. तर हे वन एक्झाम्पल डॉक्टर H. रॉबर्टने एक्सप्लेन केले रिगार्डिंग द काली कार्प अँड द ड्रग प्रूव्हिंग. Then in next para he explained about it is important that we use every means within our power to determine whether or not the occasional symptoms come from the individuality of the remedy or whether it is a deflection of the remedy dynamics through idiosyncrasies of the patient or through something the patient may do or may use that distort the reaction. Here is a patient, for instance, who cannot take the heparin self without producing a symptoms not appearing in any of our heparin proving a sensation as if a finger and the thumb were pressing either side of the larynx. Is this a valuable symptoms or is it is an individual reaction of no value? Hahnemann gave us very clear directions for making the proving and instructed us that in every case the unusual habits and the diet of the prover remain at ordinary level during the proving, so that we might know whether or not the symptoms were produced by the remedy or by changes in the prover's habit. So while doing the proving, Dr. Hahnemann give some guidelines, that is what symptoms should be considered or what symptoms not should be considered. So in this we have to follow that guidelines that is given by Dr. Hahnemann while proving the medicine. That is it is due to some changes in the diet, or it is due to the medicine, that when we prescribe the medicine to the prover. So while approving the medicine, we have to maintain the proper regular diet and proper regular regimen, that is the lifestyle indications for the prover. Then and then only we can differentiate between is it a symptom of medicine or it is the symptom of that prover due to changes in her lifestyle. So we have to maintain that guideline, and if we cannot maintain that guideline given by Dr. Hahnemann, then there may be some mistakes in that proving, and that mistakes in the proving may act as a obstacles in the pathway of cure when we prescribe the medicine to that patient. So in next para, Dr. H. Robert explained as a word about keynotes as a possible obstacles to cure is not out of place. Keynote symptoms have proved themselves as the almost equal degree a bane or a blessing. With our vast array of remedies, the average homeopathic physician learns well the polycrest. Thereafter, depending upon their relationship to his practice, he tends to depend upon memorizing a more or less brief outline of remedies. Many remedies he knows only by keynotes. If these keynotes are used as a reference to materia medica, study them serve well, but they are very dangerous for a basis in prescribing. If he prescribed on the keynote, he may often does remove the conspicuous symptoms, but this may serve only as obstacles to cure by deflecting the current of symptomatology and thus distorting the picture of the patient himself. So in this next para he also explained that the keynote symptoms are the important symptoms, but keynote symptoms are important for indicating the remedies, that is for the study of materia medica, but it is most of the time it may be dangerous to prescribe the medicine only on a keynote symptom, that is it may get wrong or it may hamper the drug picture, that is what is the actual totality of the patient. We have to consider it and we have to prescribe the medicine on a totality and not on a keynote only. Keynote symptoms are important to indicate the remedy, but and to study the materia medica, but not for the prescribing. So while prescribing the medicine, you have to consider the total condition of the patient, and then only you have to prescribe the medicine. Otherwise, it may act as an obstacle in a pathway of cure. So in this way, this is the lecture number 34, that is the deflected current according to H. Robert, and in this he explained about the different obstacles in the pathway of cure regarding the patient side, regarding the physician side, and lastly he explained as the physician should distinctly understand the following conditions: what is curable in diseases in general and in each individual case in particular. That is, he must understand what is curable in diseases, it may be in general and it may be in particular. He should clearly comprehend what is curative in drugs in general and in each particular drug. Along with disease, he also understand about what is the curative in drugs, that may be in general and that may be in particular. He should be governed by distinct reasons in order to ensure recovery by adapting what is curative in medicine to what he has recognized as undoubtedly morbid in a patient. Finally, when the physician know in each case the obstacles in the way of recovery and how to remove them, he is prepared to act thoroughly and to the purpose as a true master of the art of healing. When he consider all the things, then he may be a true master of the healing. So this is the things that is explained by Dr. H. Robert regarding how to cure the patient, and these are the different obstacles that come in the pathway of cure, that is regarding the patient side and regarding the physician side. So all of you understand all these errors from the part of patient and the part of physician, and this is the most common question that is asked for a 5 marks short note, that is the deflected current. So you have to remember the deflected currents means the obstacles in the pathway of cure, that is explained by H. Robert in lecture number 34 in his philosophy, that is the principles and the art of cure by homeopathy. So all of you understand, this topic is finished. Yes, all of you understand.
Yes, ma'am.
Okay, so we will stop here. Please send me attendance. Bye everyone.